Hey guys, welcome back to the channel. I'm Dr. Dawson, and today we're going to talk about a case that came in today, and it is a rabbit that had a head tilt. So about a 2-year-old male unneutered rabbit came in with a primary complaint of a head tilt. So what causes a head tilt? Well, it typically has to do with the vestibular system. So what is the vestibular system? The vestibular system is a part of the nervous system in which it maintains balance, and it primarily has to do with the vestibular nerve, vestibular cochlear nerve, that runs basically through part of the ear canal, and it has to do with part of the brain stem maintaining balance. And the two parts that we can see it most affected are basically a head tilt and nystagmus. So a head tilt is when their head is tilted to the side and they can't write it appropriately, and it looks a little bit like this. So if you know anybody that's had vertigo, or if you have had vertigo, it's a result of something going wrong in your vestibular system. And the same goes for rabbits. Now, what can cause this to be a little bit funky? What causes the vestibular system to be a little bit whacked out? So what causes the vestibular system to be unbalanced and get a head tilt or nystagmus? Well, it usually has to do with something interfering with one or both of the vestibular nerves, or an infection of the vestibular system, or inflammation surrounding the vestibular part of the brain stem. In the case of our bunny here, he ended up having probably something to do with his vestibular nerve, and typically that is an ear infection in rabbits. So he had an ear infection. And for him, he for sure had an exterior ear infection, otherwise known as otitis, inflammation of the ear, externa, the exterior. So the exterior part of the ear had inflammation caused by an infection. He also most likely had otitis media. So otitis media is when there's inflammation between the tympanic membrane, which is the eardrum, and the cochlea. Now the cochlea is the little organ that helps you to hear. The middle ear contains the anvil, the stirrups, and the hammer, and it's also where the eustachian tubes lead into. So the eustachian tubes are what typically do not function normally in people that end up having to have tubes placed into their ear. The tube goes through the eardrum and it basically ventilates that middle ear because the eustachian tube is either too small, or it has a lot of inflammation, or something else is anatomically wrong to where the middle ear doesn't ventilate properly and it gets a lot of ear infections. So what happens in rabbits very frequently is they get otitis media, and the reason that they get that middle ear infection is because of the eustachian tubes leading into the nose and into the throat, the pharynx. And typically they have a lot of bacteria in their mouths and in their nose, and that's normal, but oftentimes it's going to be Pasteurella multocida, which also is the cause of snuffles. And you can see that up here in this video. So Pasteurella multocida will often travel up the eustachian tubes and take hold in the middle ear and cause an infection. So other bacteria that will cause ear infections both in the exterior ear canal and the interior ear canal include staph, and the staph infection is similar to in people, where they will get a Staph aureus infection, where staph is typically on their skin or in their mouths, and it can cause basically opportunistic infections. Other types of bacteria include E. coli, Klebsiella, Pasteurella, Proteus, or Pseudomonas, and most of these are already in the environment and or in the rabbit, one of those things. And they're just opportunistic, so something makes it so that they're more likely to replicate, and then they cause an infection. Now in the case of our bunny here that I dealt with today, most likely he had staph, because based on the ear cytology that we performed, we were able to see little cocci, which are round bacteria, and most commonly these are staph in rabbits. And we unfortunately did not have the budget to do a full culture and sensitivity, which I would highly recommend if you are able to do that. So what else do we need to do in rabbits to properly diagnose an ear infection? Well, the number one thing is look in the ear with an otoscope, and it does two things for us. It tells us the type of debris that is in the ear, but it also will tell us if the tympanic membrane or the eardrum is still intact. And that's super important when we go to start trying to treat this ear infection because it really determines what we can and cannot do. The other thing that we really should do is an ear cytology, as I already kind of alluded to, and the reason for that is to tell us what type of bacteria and or yeast is in that rabbit's ear. And that also will guide us in our treatment options and our treatment protocol. So what did I do to treat our bunny here? Well, I chose an oral and a topical antibiotic. The reason I chose that is because I suspect that he has otitis externa, or outside ear canal, and I also think he has otitis media, or an infection in that middle ear. And doing just external eardrops will often not penetrate well enough into the middle ear and won't treat that part of it. And so I selected an antibiotic that I think will most likely take care of our infection and will also penetrate into the appropriate places. So what can you guys do as rabbit owners to, one, avoid an ear infection, and two, if they do have an ear infection, be able to pick up on some clues to give you an idea, hey, maybe this is going on? Well, in order to avoid an ear infection, one thing we need to do is make sure that our rabbits are healthy otherwise. If your rabbit has snuffles, they're much more likely to develop an ear infection. We also need to think about cleanliness. If our rabbit is able to clean their ears with their paws, like a typical young, healthy, non-obese rabbit is, that is going to decrease our chance of an otitis externa, or an infection of the outside ear canal. But if our rabbit is old or arthritic or obese and is unable to clean their own ears, we have a little bit higher chance of them developing an ear infection. The other thing is if your rabbit has snuffles, they're more likely to develop it. So keeping a close eye on them to make sure there's no nasal discharge, ocular discharge, or any issues with their teeth, because sometimes they can have a head tilt or an ear infection that's actually secondary to a tooth root abscess. So what can you guys do to pick up on an ear infection a little bit earlier if your rabbit does have one? Well, things to look out for are a head tilt, any shaking of their head or ears. Often it'll be itchy and irritable, and so they'll shake their head to try to relieve some pressure or kind of itch their own ears. The other thing to look out for, like I said, was a head tilt. And a head tilt is kind of getting towards a really bad ear infection. So if your rabbit is already having a head tilt, get them in immediately, because I've had a couple rabbits that have come in that had ear infections so bad that they were not able to right themselves. And they would do like this barrel roll formation, and it was really sad to see. One of them did come out of it, fortunately, but it was still very painful. And if they'd brought their bunny in a lot earlier, the chance of having that severe of an ear infection would have been significantly less. One other thing to be aware of is that sometimes an ear infection can look a lot like ear mites or vice versa. So your vet may have to do some specific diagnostics to make sure that this isn't an ear mite issue, that it is not E. caniculi, and to make sure that it is actually an ear infection. So hopefully your vet does those things and helps you have a proper diagnosis so that there can be a proper treatment. Hopefully this video answered all of your questions about ear infections in rabbits and otitis externa, as well as head tilts. If it didn't, leave your questions down in the comments below and I will happily answer them there. If I get enough, maybe I'll even make a second video about this topic. Leave a like and subscribe if you wouldn't mind, as it really helps out the channel. And if you are subscribed, make sure you hit the little bell, because that will let you know as soon as my next video goes live. If you're waiting intensely for my next video, they go live at 8 o'clock Central Time every Tuesday and every Friday. And I've kept up really well with it, guys. So hopefully you enjoyed this video. We'll see you in the next one.